Hi everyone, welcome to today's live video interview. I'm going to be talking to Dr. Rene in a little bit. We're just waiting for him to join us. Welcome everyone. If it's your first time joining us, my name is Natalia Morrison and I am an acupuncture physician in the state of Florida. And I have teamed up with FSOMA, who is our state association for acupuncture and Chinese medicine. And they are going to be offering their yearly conference this year. And they've asked me to interview some of our speakers for this year. And Dr. Rene is one of our regular speakers at the FSOMA Conference. And this year he is going to be talking about treatment for trauma and injury through the practice of Dit Da. Hopefully I've pronounced that correctly. So if you are just joining us, feel free to write in the comments section any questions you have or any comments. If you studied with Dr. Rene before, whether it's your first time joining us, just send us your favorite emoji. And in the meantime, I'm going to, oh, there we go. Hello? I think we're almost connecting with Dr. Rene.
Yes, I was having difficulties trying to connect. So can you see me? You can't see me, right?
No, I can't see you. You have to turn on your video.
It's turning right now, so.
I know that the last couple of days, the weather has been very cloudy and rainy around here, so sometimes connections and technical issues arise.
Right, I keep trying to start. It keeps telling me can't start the video.
Are you on your computer or your phone?
I am. Let me do one thing first. Hang on.
Oh, there we go. I see you now.
Can you see me?
I can see you.
Ah, there you go. Okay.
Yes.
Ah.
Hi, how are you?
I'm very good. Thank you. How are you doing?
Good. Thank you so much for giving us a little bit of your time to share with us some of your expertise and knowledge and your experience. I know that you have been busy the last couple of days, and I'm sure that you're preparing for the conference, which I'm so excited to be able to go and to hopefully meet you in person. So why don't you introduce yourself to our viewers? I know that some have been following you for some time now, and for others, this is their first time getting to know you. So why don't you tell them a little bit about you, how you got into acupuncture, and a little bit about the topic for the conference this year.
Of course. Yeah, thank you. I just got back from Bahamas, so I probably have a Bahama brain right now. So
oh, nice.
Caribbean, you gotta excuse me. Okay, so anyway, for those that don't know me, my name is Rene. My last name is pronounced Ng. My patients call me Dr. Rene, and I am stationed in Sarasota, Florida, acupuncture physician. I have been working on, I first got introduced to Chinese medicine from my family since I was around 8 years old. I was born and raised in China before coming over in my early 20s. At a very young age, I was learned to help my mom with working on people's sprains and bruises and things like that. And then gradually, I also got taken under the wing by some of my family's friends, as well as other Chinese doctors and Kung Fu masters in helping with the healing of the bruises and trauma. That became kind of like something I was very passionate about. It didn't really lead to Chinese medicine in the beginning because back when I was growing up, Chinese medicine was a folk medicine, so we didn't really make a lot of money out of that. So when I wanted to do Chinese medicine as a career, my parents say no because there's no money there. So I ended up spending the first 30 years of my life in computers. So I was doing technology, and I had a very good career. I was very blessed with that. But in the meantime, as I'm doing my computer stuff, I have a lot of friends. I do a lot of stuff. So a lot of my friends started getting injured or sick. So, you can take me out of Chinese medicine, but you can't take the Chinese medicine interest and passion out of me. So I'm helping them. And of course, my friends that I'm helping, they're not going to sue me because even though I'm not, I'm just basically helping them get better. And one of those that I'm talking about, he was one of my top Kung Fu students. He's been with me now for about 26 years. And back in 92, 93, when he first started with me, he was one of the pitchers for the San Diego Padres. And he had a shoulder injury, so I use a lot of this stuff to help him. So, but anyway, that got me continuously interested. After the dot-com craze exploded, after the bubble burst in the year 2000, my wife, she knew that I was very interested in Chinese medicine. So she said, you've always been passionate about your Chinese medicine. Why don't you just go ahead and go where your heart wants? So I said, okay, that sounds good. So I went about trying to see what it takes for me to be able to practice Chinese medicine in the United States, because up until then, I did not do any acupuncture. All my knowledge came from essentially what I'll be talking about is that that's the treatment of trauma. And there was things that you use with your hands, with herbs, and with the food and nutrition. It did not need a license. But in the United States, to do any of that, you had to have a license. So it was all under the auspices of acupuncture. I didn't know any acupuncture at that time. So I said, well, if that's what's going to be needed to be done for me to do Pita, and fine, I'll go do acupuncture. Because as I was growing up as a kid, it was always my parents telling me, someone has this issues, this pain, that thing, this is what you do. So I was loaded with a whole ton of how-tos, but no whys. It was all, don't ask, just do. Don't ask, just do. So I said, okay, so I'll just do. But as you're getting older, like in the teens, it doesn't really matter. Just follow. It's like magic. You're just like, wow, this works. That's awesome. And then as I got older, then it's like, wow, this really works. Why does it work? So the why started coming in. So I thought, wow, this is pretty cool. So I said, I've never had any interest in acupuncture, never thought about acupuncture. Most of my friends in China didn't know acupuncture. It was not a big thing. I said, if that's what it's going to take, I'll go ahead and do acupuncture and learn and go back to school. So I did. So in 1991, I started at Pacific College in San Diego, my acupuncture program. And to my amazement, I found a very, very distinct parallelism between what was taught in acupuncture schools as well as what I was taught by my parents and by our friends. And when you look about it, it makes sense, right? It's all Chinese medicine. It's just that one side I use my hands and herbs, the other side I use needles. But the principle is the same. The only thing that was different was that acupuncture focused more on the internal medicine proportion. What I learned growing up was more focused on the trauma side. So as I started developing my Chinese medicine skills, I started developing a kind of like a acupuncture treatment approach that's kind of like hybrid of both. Because of my background in treating trauma, it's literally impossible for me to look at an illness, whether it's diabetes or cancer or just a broken bone, and not be able to associate the whole body with it. In other words, I can't treat diabetes without looking and see how it affects the body. That's because of my trauma background.
Yeah.
So as a result, I came up, the acupuncture I practice today, I got my license. I've been in practice for over 13 years. And I am also a practitioner of Master Dong acupuncture. I was trained in Master Dong acupuncture in the early 2000s by Dr. Young. And one thing I found very fascinating about Dr. Young's, about Master Dong acupuncture was that very closely resembled what my parents did with their fingers.
Amazing.
So it was like a no-brainer for me. It's like, okay, great. So I got this set of tools, and this opened up a whole new world for me. So today in my practice, I'm very blessed. I have a very busy practice, and I see a lot of trauma patients, no doubt about that, a lot of pain patients, but I'm also seeing a lot of cancer patients. I'm seeing a lot of autoimmune patients, and a lot of just very difficult to treat patients. I mean, you all have seen that, like they come and they say, well, we tried everything, nothing seems to work. And
Yeah.
those are the cases I see. So anyway, that gives an idea. I've been in Florida. FSOMA has been very kind. They've asked me in the last 7 to 9 years to come and give some talks to share things. And I enjoy it because for me, even though at the conference, it's me sharing a lot of knowledge, but because I'm in a room full of acupuncturists, usually it's like between 60 to 150. And when you're inside there, it's such an interactive process because you have acupuncturists come and say, well, I have this patient, how would you approach that? I said, let's think about it. So it becomes a real case study. So a lot of times it gives me opportunities to improve on my own skills also. So anyway, that's a brief synopsis of my background.
That's amazing. I love that you started in the tech world. Well, but acupuncture is also in my point of view, it's also wiring, it's also technology in a way, but you are using a biological machine, which is a human body, and just rewiring it and reprogramming it to get it to a healthy balance.
You're absolutely correct. In fact, people ask me a lot, like when I think back in my 30 plus years in technology, I was very, very successful. What did I get out of it? How did that relate to acupuncture? It's very simple. We know that the strength in Chinese medicine is about diagnosis. That's where our strength is. We can go right down to the source of the problem. I always tell my interns, the treatment is the easy part. You got a good diagnosis, the treatment, everyone has their approach, but a diagnosis is what gives us our strength. And what I got from my days in technology, where I designed a lot of business software for corporation, was to be able to figure out and troubleshoot problems that the computers had. So if a program blew up at point A, well, the bug was not at point A. It started maybe like 6 or 7 processes before that eventually led to this current bug. So that type of thinking is being used right now in my clinic when the patient presents with a symptom. It's like, well, is this symptoms the real deal causing the problem, or is there something underlying coming from somewhere else? So just automatically my brain thinks like that. So I really attribute that to being in technology.
That's amazing. That's so exciting that you have those two worlds to help balance also in your mind, and that you're from an early age, your parents taught you this type of medicine. And when you went to school and finally decided to follow your passion, to see how, your parents were kind of right on. And I think as a child, it opens up a different level of respect and understanding, not only for the art of acupuncture, but also for your parents as physicians in their own right.
Yeah, it definitely was. And like I said, when I was a kid, didn't know much about it, just kept doing it. In fact, I'll share a secret with you guys, kind of a secret. Some people already heard me tell the story before, but how I started in Chinese medicine, I was not this prodigy that people look and say, wow, look at that guy. He was so good from day one. No, I had absolutely no interest in Chinese medicine. But apart from being, a dutiful Chinese son, where you do what your parents tell you to do and do not argue back, do not answer back, they tell you to jump. You don't just say how high, you take a measuring ruler and measure how high they want you to jump. But what really sparked in me was Kung Fu movies. So why Kung Fu movies? Because in Kung Fu movies, I started seeing people doing these death touches. They go to an opponent, they hit a few pressure points, and the opponent is like frozen.
Yes.
Now, why would that interest me? Well, when I was a kid, I was a very tiny guy. When I graduated from high school, grade 12, I was only like about 5'1", 5'2". I was like about 90 pounds. So as a kid, I was 4 feet 5, 4 feet 6, scrawny 60, 70-year-old. What happens to those kids? They get bullied.
Yeah.
Right? So I always envision, someday I learn all these pressure points. I'm going to go to the bullies and hit the pressure points, freeze them, then I'm going to kick their butt. That's really why I wanted to learn Chinese.
I love that. I love that. You know, I have a lot of patients ask me if those points are real and if I can do them. And I always say, yes, they're real. No, I do not do them. I did not study them.
Mhm.
But yes, I can understand the fascination because I've also had that fascination. I am pretty small. I'm 5'2". I weigh less than 100 pounds. So that idea of, you know, those little tricks of the hand to make sure that you're safe is
Mhm.
pretty attractive, right?
Yeah, absolutely. Definitely.
Yeah, that's amazing. And so at the FSOMA conference, you're going to be sharing with us the deep, how do you pronounce it? Deep, that?
Is a yeah in Cantonese is actually a big art practice in southern China. It's called Da. In the Mandarin, it's pronounced Da. Okay, so actually, this modality doesn't have an official name. It is just what the kung fu masters use to treat people who come in with broken bones, dislocations, bruises, injuries, pains, cuts, stab wounds, and things like that. Deep means to fall, da means to hit. So basically, this
Oh,
is an approach to go in and treat all injuries and issues stemming from a fall or a hit. And if you think back over like a couple hundred years ago, before the advent of guns and gunpowder, what did we have? We had our fists, we had our fingers, we had our knives, we had our spears, and we had our chains and I got the darts and stuff like that. So those were all the types of things that can inflict injuries on people other than your typical accidental falls and breaks. So Tita was this thing that was able to go in and help people help people that got injured heal. And the dominant doctors that practiced Tita were, and you can guess, the kung fu masters. Because in China, when we practice kung fu, we learn not just to break someone's bones, we learn to put them back together. It's a very
yeah.
simple technique. And then for us, it's like when we practice our styles, kung fu is taught like a way of living, not like a class here, not like an athletic class. So every kung fu style has its own specific characteristics. I practice Wing Chun. I've been practicing Wing Chun since 1973. So I've been practicing for a while. So we have our own unique type of injuries that we inflict on people. And within every Kung Fu family, we have herbal formulas, combination of herbs that we put together that specifically cater to the type of injuries that we inflict on people. Some styles inflict more upper body, some styles inflict more towards the lungs, some styles are more pressure point related, disrupt the chi. So the herbs used to treat those injuries are unique to each family. But when you take away those types of injuries and you look at the type of injury that people have from falls and breaks and stuff like that, across the board, you have the same types. Someone goes and sprains the ankle twists this way. Well, you have the pain, like you twist this way, you have a lot of hyperextension, okay, on one side of the thing, and then you have to massage, and then you have to put the herbal paste there. So then there is a general set of herbs that are used across all types of injuries and pain. And then depending on whether it's a fracture, a bone, or whatever, we would then customize those types of herbs. So basically, in history, Tita was always used by all Kung Fu practitioners. They were mastered by all the Kung Fu masters. And they were generally not taught outside. They were always taught from the Kung Fu teacher down to the students. Now, and I think it's like about 200-300 years, I don't know the exact date, but somewhere along the line, people started thinking, well, you know, if Tita, which was the collective term used for if someone had a injury or a trauma, you would go see a Tita doctor. Hence, Tita became the term used to treat injuries. It's not an official modality, but it's a term used for that. So over time, people started thinking, well, if Tita was used to treat injuries that a Kung Fu master inflicted on another person, why can't we use Tita to treat injuries that were not inflicted by Kung Fu master? Logical,
Right.
right? So
Yeah.
then it became, Tita then became used to the general public. People will go to a Tita master and say, hey, I have a sprained ankle, I have a torn meniscus, I have a frozen shoulder, I dislocated my shoulder, my neck is twisted from sleeping poorly. The Tita doctor will be able to go in and help. None of this is using any acupuncture at all. These are all using hand techniques, a lot of massage, a lot of herbs, using liniments, and using foods to help manage the healing. Because some foods can make the healing slowed. Some foods can make the healing faster. Some foods are better for nourishing and strengthening bones. Some foods are better for nourishing tendons. What kind of injury does the person have? We need to know. So for Tita, once we go in and assess the condition, what caused the injury, we will then treat that, and then we will be able to help the person. Usually, very fast, the person heals. And a few hundred years ago, Toina was born out of Tita. So Toina, Toi means to push, Na means to pull. So people started saying, what if we took some of these techniques and forget all the Kung Fu? We just use these to help with sprains and stuff. And oh, by the way, what if we don't, we use the pressure point principle instead of something like praying mantis, where you're going in to stop the qi from flowing and disrupt it, causing some, potentially lethal degradation of the body. Instead of that, why can't we use the finger to stimulate the qi and smooth out the qi? Acupressure. And as a result, Toina utilized a lot of the Tita techniques for helping pain and trauma, and using the acupressure techniques to help with internal medicine, leveraging the knowledge from Chinese medicine and acupuncture points. So that's modern day Toina and Tita.
How fascinating. I didn't know that history. So I've always, or the way that Tuena has been translated for me has been manual therapy. And if Tita is before Tuena, what would be maybe like in English words a good way to describe it?
Describe what Toina or Tita?
Tita.
That's a very good question, because if you look at the scope of Tita, not in the US is very limited, okay? Because when you look at in China, Tita doctor, he does the job of an osteopath. So he sets bones, he relocates joints, okay? He does the job of a massage therapist. He would go in and do the circulatory massage. He would do deep tissue kneading, and he would get the blood into the joints and into the muscles. He would do the function of a physical therapist to help the joint heal itself and rehab itself and re-strengthen, recondition. He would do the function of a nutritionalist, because he would have to know the herbs to help the person heal, what to avoid and what to take. Wow. He would also have to have the knowledge of the Chinese doctor, because he would have to understand why certain injuries are not healing faster than others. For example, if someone has a history of let's look at it from a Western perspective. They look at the chart, they have a vitamin D deficiency, calcium deficiency, okay? In many of those instances, we can easily see a correlation in the Chinese medicine with some kind of a kidney deficiency. As we know, kidneys manage the bones. Right. So if a person came in with a broken bone, what do you think you're going to have to do? Give the patient kidney tonics, right?
Right.
Because otherwise that bone might not heal fast. That could also be the reason why this patient could be presenting with a history of recurring bone fractures, because the bone is not strong enough. Same thing with the tendons and sinews. Well, the person had chronic liver imbalances. Now the sinews, the ligaments, they're all very, very weak. So the person is constantly spraining the ankle, spraining the knee, having issues with the neck, easily tight and get locked up. Those are all weaknesses inside the joints, the ligaments, and the soft tissues. So a Tita person will recognize that and be able to then prescribe the types of herbs for the liver. Now, a Tita doctor may not be as versed as a Chinese TCM doctor, knowing, oh, you have a liver yang rising, you got liver fire, you got liver qi stagnation, you got this. But the person will be able to look at that and say, okay, recognize you got liver problems. And the liver does this and this and this and this. So what the detailed person will know is to go and feed the liver. Less concerned about the syndromes, more concerned about how to rebalance the liver and know how to use the herbs for that.
Sounds like a truly holistic approach.
It truly is. That's why I say when in my clinic, my interns will tell you when I'm working with a patient, you have to look at all the different angles. And at FSOMA, I will be talking to the audience, what makes deep dive effective, okay? The treatment, brilliant, but even more so is the diagnosis. Because one of the things I will always say, and those who have taken my deep dive classes before know this, if a person has an ankle problem, for example, there's a good chance the source was not the ankle. It could have started, for example, with the wrist. The person had wrist problems, okay? So the wrist now is weak. Now the person tries to turn a certain way to accommodate the wrist. Now maybe injure the elbow, maybe injure the shoulder, that same side. When the right shoulder injured, what does the body do? Compensate with the opposite side. So if you start lifting up and your right side is weak, what does the person do? More on the left side. So now the strain on the left side, now the upper part the person used, the body now uses the middle part, which is the gluteus, the lower back area, on the right side to compensate for the left. So now your middle part of the right side is going to be taxed. When that gets taxed, guess what happens? Now your knee and your left leg comes into play to try to help out the right back. When you're over there, now your left side becomes strained, your left leg becomes strained. Therefore, now your whole body weight gets placed on your right side, constantly straining the tendons, ligaments, and the ankle joint on the right. So if you experience pain on your right side, you need to see if any of what I said played a part in that. If any of that did and you don't address that, that ankle will never heal. So that is the big part of the data is I always tell my students, like when someone has an injury, you need to come up with an approximate story. I say approximate because you can never ever tell what actually happened. You need to come up with I don't want to say story because it sounds like something made up, but you need to come up with a diagnosis that shows how an injury actually occurred, how the fall actually happened, how the twist actually happened to enable that patient to come to the pain you're trying to treat. Because if you're able to trace how that injury happened, you will be able to track back and treat that whole process.
I agree. I think that's really important. And luckily, I feel very blessed. I had a teacher in my school, Kevin Clark, who I adore, that would, in the clinic, he would have patients sometimes repeat their story over and over and over, because sometimes the first time the person tells you the story, you might miss a very important detail. And like you said, it didn't always start maybe in the ankle. It started years before, maybe with the head trauma or the wrist or whatnot. And so having that timeline and being able to map out that timeline and trace it back gives you a better idea of the puzzle. And so I think that's brilliant that you share that and that you share it with your students. That's so important as a physician to be able to map that out and troubleshoot it as well.
Yeah, absolutely. And that's what makes deep dive effective, because like I'll use an example in a case. I had a patient come in with a few years ago, both medial meniscus in the knees, severe pain. Late 50s gentleman, he was going to have to do surgery. He came in, took a look, and then his friends asked me to try and take a look at him. I did. And make a long story short, his problem was not the meniscus. His problem was both of his feet, the outside of his feet. His feet were curving outwards. His meniscus were trying to pull the leg back in, therefore straining the two meniscus. I fixed the both ankle. I treat the meniscus. His knee now is fine. About 85% of his pain is gone.
Amazing.
So that's kind of like what the diet, and then of course the other part of it is the herbal part. You have to know what kind of injury there is. There are some herbs that are better for qi stagnation swelling, some better for blood stagnation swelling, some better for tears, some better for dislocations, some better for repairs, some better for broken bones. So we have to learn how to mix those herbs. And then when we're doing the hand technique on the individual, the injury area, we use a liniment, which is a wine soaked with herbs soaked inside them. And then we use the wine like a lubricant, but when we massage it, the friction opens up the pores and then the wine gets seeped and gets soaked into the injury area and then helps with the healing. So that whole part is very, very unique to Dita. And in China, anytime you see that, oh, Dita. In fact, anytime anyone get injured, they say, oh, you're going to the Dita master? That's what they always say.
And you're going to be sharing all that information with the students at the conference this year?
Yes, I will be sharing that with the students as much as I can because FSOMA gave me a 3 hours time slot. So I will share as much as I can. Yeah. I am actually going to be following that up with a weekend certification in Dita, 2-day class in St. Pete, where we're going to go through, in gory details, the herbs, the diagnosis. We're going to do a lot of case studies and stuff. And then at FSOMA, it's going to be an interactive class. I'll be talking, I'll be explaining stuff, but I'll also be asking, the attendees to come up with cases that they have trouble treating, and that way we can discuss it right there, and that's the best way for students to learn.
That's amazing. And do you already have the dates for your upcoming seminar? Yes. In St. Petersburg?
Yes, it's going to be on October 5th and October 6th.
Wonderful. So hopefully once you have all those details, let me know so that we can share it on the Florida Acupuncturist page as well.
Definitely.
And get more. I'm sure that a lot of people are really interested. Everything that you've shared with me sounds fascinating. And for those of you that enjoy Tui Na and have reaped the benefits of practicing Tui Na, it sounds like your class, your workshop is what's going to help them elevate and integrate in a whole different way. So if you're a Tui Na fan, definitely come to your class.
Yes, you are absolutely correct. Because one of the things is a lot of times when you practice Tui Na, you are taught the techniques. A lot of times you don't really understand why you need to do this and why in that sequence. In Dita, you can't start treating someone without knowing what happened to their body and how you want to fix it. If the bone is broken this way, you have to go and fix it back that way.
Yeah.
You see what I'm saying? So you have to know how to break to be able to treat it. So Tui Na people would definitely benefit from that tremendously.
Wow, Rene, thank you so much. I so appreciate your time. I know that, like you mentioned, you just came back from the Bahamas. You have the Bahama brain.
The Bahama brain, yeah.
Yeah.
Yeah, man.
But thank you so much. I really do truly appreciate you sharing all your passion and your knowledge and this beautiful art form that luckily it's practiced in China, but we are so new to it. And it's physicians like you that help our profession grow and evolve. So thank you so very much.
My pleasure. Thank you for having me. I really appreciate it. I look forward to seeing you at FSOMA and everyone else.
Yes. Thank you. And thank you everyone for watching. We will see you soon. Bye.
Bye.